I'm Dr. Daniel Schroyer. I'm the Medical Director of Radiation Oncology at Baptist Fort Smith. Radiation oncology is a very important part of cancer treatment. About at least 60% of cancer patients receive radiation therapy. It's important for curative treatment, which is trying to treat patients and cure them of their cancer, but also what we call palliative treatment, which is important in relieving pain in patients that may not be curable. So I see pretty much every type of patient as long as they're adults. So we don't treat pediatric cancers here. But the three most common types of cancer we treat a lot of are breast, prostate, and lung. But we also see any type of rare cancer here. We are able to make referrals if necessary, but it's always important to have a local oncologist, whether that's a medical oncologist or a radiation oncologist, to help direct your care and to be closer to home if you have problems or symptoms or other issues. There's different types of radiation, and so we do what's called photon radiation therapy. Proton therapy is becoming more popular. In specific cases, I will make referrals for patients for protons if that's what I think they need, but I typically think it always makes sense to start with your local radiation oncologist. Cancer care is never just one physician. Typically, there's multiple specialists that are involved. We also try and work with primary care if needed, but typically patients will see a medical oncologist, a surgeon, a radiation oncologist, any other type of referrals that need to be done. We typically will manage all of that. So radiation has changed quite a bit over the years. There's a lot of misconceptions about radiation therapy in terms of side effects and length of treatment. Every patient is unique, and so every patient will get their own radiation plan, and that's typically based on scans and different types of imaging that we do. And treatment courses have dramatically decreased in time. That's not always the case, but there's many types of treatments where we can do 5 or less treatments, whether that's for lung cancer, breast cancer, prostate cancer. And certainly palliative treatments are typically shorter courses of treatment. And so over time, as technology has improved, the amount of treatment length has decreased significantly. The external radiation is it's painless. You don't feel it. It's just like getting an X-ray. A lot of patients don't know we're doing anything to them. It's all delivered via external treatment, and it's usually delivered with the help of a computer system and a planning system. And so there's a lot of technology that goes on behind the scenes to deliver radiation therapy safely and effectively. As a physician, my first duty is to do what's best for my patients. So if there's a treatment that we can't do or that I think can be done somewhere else, then I'm more than happy to refer patients out. Cancer treatment has just gotten so much better. And it's kind of amazing to see. As a cancer physician, personally, I think of different treatments like melanoma, renal cell, and these other types of things where that was a death sentence, or mesothelioma. So there's certain treatments where we see now where patients are just having dramatic responses, and I'm just blown away by some of the responses that I see.